diabetes, the Central Drugs Standard Control Organization has cleared Novo Nordisk's world-famous drug Ozempic's injection containing semaglutide. The drug is administered under the skin and is meant for patients who struggle to control blood sugar through diet and exercise alone. It can be used either by itself or along with other diabetes medicines as well. It's manufactured in Denmark and France, and it's now available in India as a fresh hope for millions of people battling type 2 diabetes. We have my colleague Sudha Sadanand with us in the studio. Sudha, talk to us. This is big news. Ozempic is a famous drug. It's a fashionable drug now because celebrities from Hollywood to Bollywood are taking to it, and there's a lot of curiosity surrounding it.
Yeah, but you know, Krishna, the thing is that it is more about controlling type 2 diabetes. That's because I think India, I remember the Time magazine a couple of years did a special story on India and how it's become the epidemic in India. And now recently on, News9, on this very same channel that you're all watching, ladies and gentlemen, we spoke about how in India, if you look at it, the statistics are alarming when it comes to the South. Now, the misnomer, Krishna, is that South eats healthy, but then there are several other reasons. Now, coming to Ozempic, it's primarily a drug for type 2 diabetes, and there are lots of cases where despite metformin and all the other medicines that you take, somehow you're not able to control your blood sugar. The spikes happen. When do they happen? You have to keep a very, very close watch. Diabetics, also some of them wear, patches to see it. But of course, it is also about weight loss, and it is also about controlling your appetite. Now, that's why, Krishna, it's called a fashionable drug. But I wonder if that the pecking order should be, it controls type 2 diabetes, and 2, it keeps your weight under control, because if your weight is above what you should be, then obviously it's a kind of a bothersome thing for those who have sugar-related issues. And also the point is that, of course, a lot of stars have started using Ozempics, but I remember a book by very, very famous endocrinologist, Dr. Ambrish Mittal, who wrote a book recently called The Weight Loss Revolution. In that, he makes it very, very clear, Ozempic, but then how to use it is very, very important, Krishna.
Yeah, that's a very important message you're giving it, Sudha. I even as you're breaking this story that Ozempic is set to make its India debut. The Central Drug Standard Control Organization has cleared Ozempic injection, but as Sudha was rightly pointing out, you have to ensure that it is used in the right way. It is not exactly a silver bullet for all your problems, so it has to be ensured that the people are not jumping into Ozempic blindly, so that because they see all these stars losing weight and becoming quickly thin and looking absolutely fantastic, and in a sense these stars have become sort of brand ambassadors for Ozempic, isn't it? Although sort of official, no stars yet to officially come out and say I'm taking Ozempic, but the fact of the matter is that people need to exercise great caution before they choose to take Ozempic, isn't it?
Absolutely, very well said. And Ozempic is a drug which you can use even if you're insulin dependent, you see. So the thing is that it's an added layer. It's like you have something, if you're on protein, you also have a shake apart from what you ingest in your diet, so that your type 2 diabetes, and let me tell you about the popularity of it. I have some statistics in front of me. According to a pharmaceutical company, they say that the Indian market is steadily growing, and now it stands at around 625 crores as of June 2025. So it's accepted. I will not use the word popular, but it is accepted. But like Krishna Kumar said, with caution, if you have type 2 diabetes or if you're prone to, because I remember yesterday on Point we did a show about heart disease. A lot of young people are falling prey to that. One of the reasons is, are you screening yourself for your sugar levels? In case you find yourself that you are on the border, go to a doctor, consult him. But yes, it's a revolution. Ozempic now shall be in India.
And not just Ozempic, so that you have similar Ozempic drugs parallel to it, similar to it, also hitting the Indian market, this weight loss fascination. And also, one is the fascination of the weight loss, Sudha, and the other is the fact that, type 2 diabetes is probably one of the biggest diseases in this part of the world, in South Asia per se, and Indians particularly per se. It's a lifestyle disorder, and Indians have been found to be increasingly prone to it, and that is the reason why the high levels of curiosity surrounding the solutions for type 2 diabetes, isn't it? And Ozempic is just the beginning. You're going to have more and more drugs from fellow other drug makers also hitting the market.
That's absolutely right. And let me also say about statistics, because we can call anything a revolution, but it has to be on News9. We always support it with data. The market in India has increased 27%, Krishna. And that's not a joke. And after all, we are very careful with what kind of drugs come in here, what kind of drugs are used. I remember there was a drug in between which was about enhancing your memory, and they put a lid on it and they said, this is all bunk. Nothing can really make you that, make you, kind of sharpen your memory. We also have...
Okay, stay with us, Sudha. We have Dr. Ambarish Mittal, Chairman and Head Endocrinology and Diabetes at Max Healthcare Hospital, now joining us. Dr. Ambarish Mittal, thank you so much for being with us over here. Ozempic is all set to make its India debut. I want your thoughts on that. The injection is what has been approved. It's not like Indians don't know what exactly is Ozempic, but now the Central Drugs Standard Control Organization has cleared the Ozempic injection.
Yes, I think it's great news. We've been using drugs of this class for the last 2 decades, but semaglutide is a significant advance for our people with diabetes for a couple of reasons. Basically, it in addition to controlling diabetes very well, it also reduces the risk of heart disease. Heart attacks and major adverse heart events are reduced by about 25% in those who are on Ozempic, those diabetics who are on Ozempic. Similarly, it reduces fatty liver disease, in fact, treats fatty liver disease. It reduces the progression of kidney disease. And on top of all that, it helps in weight reduction, which most diabetics require. So I think it's a very welcome addition to our armamentarium for treating diabetes.
Sudha here, nice to have you on the show. Many congratulations for your book, The Weight Loss Revolution. And here you are. I mean, here we get this breaking news. But doctor, the thing is that there are 2 aspects to Ozempic. One is, of course, for type 2 diabetic patients, how it controls. Like you said, you've been using it for 2 decades, but here it is. And perhaps it also kind of, restrains the liver disease and keeps your kidneys in shape. But then, what is your view about using it perhaps only for weight loss? Because that's a kind of an epidemic which is, spreading across the country, and particularly amongst those who want to stay, thin for whatever reasons.
So I think if you look at obesity as a disease, as we doctors do, as endocrinologists do, which means that if you have excess fat in the body, it's not just cosmetic. In fact, for us, that's the last thing. It's more important that obesity itself can give rise to a variety of disorders, of course, including diabetes, heart disease, high blood pressure, fatty liver again, and even types of kidney disease, some kind of cancers. There's so many things linked to excess body weight. Now, if we have a tool that can help us reduce that body weight, in addition to, of course, our diet and exercise and the things we've been talking about all these years, it's definitely a welcome addition. It does not mean that anybody can go on the drug. It also does not mean that people use it just to lose a few kilograms for cosmetic purposes. But those who are suffering the ill effects of obesity are clearly candidates for, GLP-1 drugs, including semaglutide.
Okay, Dr. Ambarish Mittal, I also want to ask, even as Ozempic is set to make its India debut, you have competitors. Eli Lilly's Mounjaro is there, and there are other competitors as well. Are all of these drugs in the category are the same in terms of the benefits that they can provide, and also the risks that they entail?
So basically GLP-1 drugs, as I said, have been around for 20 years, but the 2 that have made a big mark because of their powerful efficacy are semaglutide and tirzepatide, that is Ozempic and Mounjaro. Ozempic or Wegovy and Mounjaro. Now, these drugs are important because they are effective far more effective than their predecessors. So broadly speaking, they have similar effects, but there are subtle differences. There are certain differences in the mode of action of tirzepatide or Mounjaro, which uses not just GLP-1 pathway but also GIP pathway. So maybe it produces a slightly greater weight loss than semaglutide. Whereas semaglutide in persons with diabetes has been shown very significantly to reduce heart disease and other complications. So it's all a good thing for us doctors to have these options, for our patients to have these options, so that we can treat, depending on the patient profile.
Fair enough. We'll leave it at that. Dr. Ambarish Mittal, thank you for joining us with that perspective here on News9. Now, we also have Dr. Sanjeev Bagai, Chairman, Nephron Clinic, also joining us on the broadcast. Dr. Sanjeev Bagai, thank you for so much for being with us over here. Ozempic is set to make its India debut. The fact of the matter is GLP-1 drugs, as Dr. Ambarish Mittal was telling us, has been in the market for 2 decades. But the fact of the matter is that Ozempic has been the single most popular drug across the world, and it's a big moment that is going to enter the Indian market.
I think it's a good news. It's a news which gives an extra ammunition as far as the medical doctors are concerned. It's specifically initially used for type 2 diabetes with obesity, but now, of course, the indications have been expanded. It's even been used for metabolic liver disease. It's also shown very good results in certain neurological and psychiatric disorders, and so on. 2 limited points as far as this is concerned is that it should be used only strictly under medical guidance, and preferably under strict control of an endocrinologist who's well versed in using this drug. Point number 2, it should not be used for cosmetic uses or for a rapid weight loss, either for a function or an occasion. A lot of people are tending to do that. It's a word of caution. And point number 3 is the cost. So I think keeping these 3 things in mind, you have to also keep the 4th thing in mind, is that it carries certain side effects, which are known side effects, which need to be monitored. It doesn't become a deterrent or a contraindication, but something which we have to keep a watch on with regards muscle loss in different parts of the body, or indeed ophthalmological complications like loss of vision or gastrointestinal effects, which need to be monitored. So it's a good drug. It can be a life-saving drug to prevent complications from obesity and uncontrolled diabetes, but under medical supervision only.
All right, Dr. Bagai, this is Sudha here. Thank you so much for joining us on this broadcast. That's what was really bothersome. And good you said it, that, there have to be, this is not a deterrent, as it were, for cosmetic surgery, to use a phrase.
Yeah.
But the point is, Dr. Bagai, is that how does the government then put a deterrent that I can't, buy it off the shelf and perhaps start using it? Because this, a lot of stars, a lot of influencers from the Mumbai film industry and across have been using it. They've been putting pictures and they're saying, yes, I've used it. And so, they've almost challenged the audiences, as it were. So what do you think the government should do? Because you said there are side effects to it and one doesn't know what kind, but you've of course listed them. But how do you think this should be controlled, Dr. Bagai?
So there are 2 important parts in this with regards to the regulation. And the first part is the most unregulated and unsupervised segment of Indian healthcare, which is a part and parcel of Indian healthcare, but not paid so much of attention on and not put under surveillance, so to say, is the pharmaceutical outlets, which are chemists and pharmacies. So unless and until we don't have a valid prescription which is dated, unless and until it does not carry a doctor's name and the qualification, they should not be giving this medicine. Now, I know for a fact that there are a lot of chemists in smaller towns or even in vis-a-vis in larger metros who would tend to give it if the family is known and things like that. I think that should be curtailed. And point number 2, it should be a strict deterrent with regards to pharmacies and chemists not to give it. And the records of these pharmacies, especially in smaller towns, should be urged to be made digitalized. That's the only way we can keep a watch on the sales, procurement, supply chain, and the total number of doses which have been consumed on a weekly and monthly basis.
That's what is scaring me, Krishna, that, we can buy it off the shelf and perhaps have it, and then you never know what the side effects. Very, very well put, Dr. Bagai, to say that there has to be monitoring on this.
Okay, fair enough, because one is the government giving the approvals to them, like you're pointing out, and government ensuring that now that the approval is given, that the authorities concerned are able to keep a complete track of where and when it's sold. Is a fair point that you're making, Sudha. But while we give out this news, it's as you rightly been telling us right from the beginning, it's for all those watching this broadcast, it's an important drug that's meant for type 2 diabetes and the complications resulting from it. But it is of utmost caution that needs to be exercised to ensure that this is not used for cosmetic purposes. That's in fact what 2 doctors have told us in a span of the last 5 minutes, isn't it? Not to be used for cosmetic purposes, Sudha.
Absolutely, and be very, very careful about what really, how are you careful about it? Dr. Sanjeev Bagai, considering that it's now spread and it's almost like a mini epidemic, particularly in South Asia and India, is also not doing very well so far as type 2 diabetes is concerned. Does this drug work in a similar fashion amongst age groups, or there are different strokes for different folks, as it were?
Studies which have come out in Lancet and New England Journal of Medicine, which have compared different GLP-1 agonists in terms of the doses, with one against another category, and also with regards different age groups, and they've done an adjusted what we call as a odd ratio to show the effectiveness and usefulness of it. So it works very well across age groups, but like I said, you have to keep a watch on certain comorbidities, keep a watch on certain factors so that we can lessen the load of the complications, known complications which can set in, and keep a watch on weight loss in terms of muscle mass loss. Now, muscle mass loss is called as sarcopenia. So we need to make sure that the patient doesn't lose too much of muscle mass, but loses more of the fat. So I think it has to be monitored. The dose has to be adjusted regularly and titrated in a stepwise manner, and make sure that the blood sugars are monitored, because a patient shouldn't have hypoglycemic episodes. So it has shown very, very good results. In fact, in some of the studies, it has shown almost up to 13 to 17% weight loss, but make sure that the muscle doesn't go, the fat goes.
Fair enough. We will leave it at that. Dr. Sanjeev Bagai, Chairman, Nephron Clinic, thank you for taking time out to be with us. And of course, my colleague Sudha Sadanand, thank you for being with us here in the studio for this big breaking news. Moving on to some more breaking news. India has registered its protest in the Asian Cricket Council or ACC meeting about the attitude of ACC chief Mohsin Naqvi. India and other board members have made sure that Naqvi said congratulations to Team India. BCCI's Vice President Rajiv Shukla and Ashish Shelar demanded that Mohsin Naqvi immediately submit the Asia Cup trophy to the ACC headquarters. India has also told the Pakistan Cricket Board chief that they will take this matter further with the International Cricket Council or ICC. And we have our input editor Brijesh Pandey set to join us with all the latest details on this breaking news story. India has registered its protest at the Asian Cricket Council meeting